Now with a report on monitoring for early detection of breast cancer. Here's our reporter, Laura Windsor.
When it comes to a woman's breast health, she must be aware of early detection, breast exams, nutrition, and lifestyle choices. Diane Dieterle of St. Jude Medical Center in Fullerton discusses the importance of breast health.
What women need to know about breast health is very important. It can be broken down into actually 3 different areas, and one can think of it in terms of a triad or a triangle. The first aspect of the triangle would be breast self-exam, which would also include breast self-awareness. And breast self-awareness is probably one of the keys to early detection of abnormal breast findings. So the first part of a breast self-exam is to do a visual inspection in the mirror once a month, and what you're going to be looking for are any kind of changes in the character of your skin, any changes in the contour of the breast, any sores that are not healing, any unusual discharge around the nipples. This doesn't mean that you have breast cancer, but it means that you need to follow up with your healthcare provider. The second area has to do with positioning yourself in a comfortable position, and this would be either lying down or placing yourself on your back with your arms in a relaxed position. And once the position is obtained, then you want to start in a systematic pattern of going through the whole perimeter of the breast tissue. The second part of a breast self-awareness program and the triad that we discussed, the triangle, would be to have a clinical breast exam done by your healthcare provider. And this should be done on an annual basis. It's usually recommended that this starts around the mid-teen years or at least by age 20. The third aspect is having a mammography done on a yearly basis for those women starting at approximately age 40. And again, you will need to check with your healthcare provider because there are certain criteria and risk factors that may require that you have diagnostic screening done at an earlier age. Another important thing to remember is that when providers are evaluating mammograms, it's real important for them to do comparison films. They want to see how you're doing over time because mammograms pick up very microscopic changes, and it is important to be able to have access to all of the films that you've had over the years. It's much easier to do this and much more effective if you select a center that you go to every year for your mammogram care. Some of the wonderful things about the breast center at St. Jude are that we have a highly trained and technically certified team of experts. Our radiologists are certified and read approximately 30,000 mammograms a year. And this is something to really keep in mind when you're selecting a place to have your mammograms done. You want to not only have a place that has good technology, and St. Jude does have state-of-the-art technology, but you also want to have a team of experts that are able to utilize the technology to benefit and find the best outcomes.